Hi, yeah, I need an exterminator. I have rats in my basement. Okay, could you guys come out like maybe Tuesday? Perfect, thank you.
Hello, my name is Dr. Hill. I'll be your doctor this evening. Can I see your wristband, please?
Of course.
And can you state your name and your date of birth?
Savannah Joyner, 11/16/01.
Thank you. So, how are you feeling today?
I'm feeling terrible.
I'm so sorry to hear that. Could you please rate your pain on a scale from 1 to 10?
I'd probably say like a 7 out of
A
10.
7 out of 10? Okay. And can you please tell me when you started experiencing this pain?
Just recently, within the past few days or so.
Okay. What does it feel like? Can you describe it to me?
Yeah, I've been having terrible sharp pain and stomach pain followed by vomiting, and the last few nights I've been waking up in the middle of the night with trouble breathing and I've been like continuously vomiting.
Okay.
I've also noticed that my face has been getting to swell up, and I don't know really why. And last night I took my temperature and it was 101.
101?
Yeah, and then I've also had this horrible painful headache for like 24 hours now. It's kind of just all over the place too. And just overall, I just feel like so bad. I've never felt like this before, and I really need the pain to stop because I have kids and a job to get back to. Do you think it's a fever?
Thank you for describing your pain in detail. It really helps with my diagnosis. It could possibly be a fever or some sort of infection. Can you tell me if you've taken anything for it?
Yeah, I just keep taking ibuprofen, but it really doesn't really help that much.
Okay. I've noticed your hand is wrapped up and it appears to be bringing you some pain. Do you mind me asking what happened?
Oh, it's really nothing to worry about. About 2 weeks ago, we found out that we have rats in our basement. Luckily, we got an exterminator out to the house to take care of them. Unfortunately, before the exterminator came, I went to the storage because I was bringing up some boxes to decorate for Christmas, and one of those rats bit my hand. It hurts sometimes, but I feel like it's kind of healing now.
Okay. And do you mind if we take a look at the bite?
Yeah, of course.
And you said a rat bit your hand? How long ago did you say that was?
About a week and a half ago. It's right here.
Okay. Thank you for showing me. At first I suspected a fever or some sort of infection, but now that you tell me you've been bitten by a rat, I suspect you could have a virus.
A virus? How could I have a virus?
It's a virus called the Lassa fever virus. It is possible that you contracted the virus via the rat bite. Rats are considered transmitters and carriers of many diseases. The symptoms you described sound spot on to the ones associated with the Lassa fever virus. You said you mentioned feelings of nausea and vomiting, difficulty breathing in the middle of the night, a swollen face, back, abdominal pain, and headaches. All of these symptoms can occur within 1 to 3 weeks of being in contact with the virus. So you said you were bitten about a week and a half ago. That can explain why the symptoms are happening right now.
Oh, okay. Well, do you think that, like, I'm gonna die?
Oh, nonsense. I will request that an ELISA test be performed to confirm my suspicions on the Lassa fever virus. If I am correct, we will try everything in our power to make sure you are okay, and we prescribe you the proper medication to treat the virus.
An ELISA test, how will that show you if I have the virus or not?
Okay, an ELISA test will use antibodies to detect proteins in your sample. The Lassa fever virus and other foreign molecules are seen by your body as invaders and activate an immune response. These foreign invaders are called antigens. Your immune system will make an antibodies in response to antigens, and the antibodies will bind to antigens and flagging them for destruction by immune cells. This is how we will be able to see if you have the virus or not.
Oh, okay. Yeah, that makes sense. Thank you.
All right, I'm gonna put in that test for your ELISA test, and the results will come back shortly, okay?
Okay.
Hello.
Hi.
I do have your test results back, and if you look right here, they do come back positive for the Lassa fever virus.
So all of this is because of a little rat bite?
Yes, I believe whenever the rat bit you, you came into contact with the virus. Like said before, rats are carriers of many diseases. It could also be possible that you contracted the virus with droplet transmission via aerosolized rodent droplets.
Oh, that would make sense. Before the exterminator came, I noticed that there was rat poop in the corner on our kitchen floor. And how could I prevent this?
The best way to prevent this, the spread of this virus, is avoiding rats. But in your case, I know that must be difficult. Next time, just make sure you aren't eating or drinking any food that you know have been left out, because rats can get into that and infect it. And also, just making sure you're avoiding the food contaminated with like rat feces or urine is key to prevention.
Okay, thank you.
And then yesterday you mentioned you've been taking a lot of ibuprofen to help with your pain. You also mentioned that it hasn't been helping much. I'm going to prescribe you with ribavirin. This is an antiviral drug that has been shown to be most effective when given early in the course of the virus.
Okay, is there anything else I could do to help this pain go away?
Another way to decrease the symptoms of this virus is rehydration and supportive care. Make sure you're getting plenty of rest and drinking plenty of fluids.
Okay, thank you so much for your help.
Do you have any more questions or concerns?
No, I don't think so.
And I'm just going to give you this pamphlet. It gives you a little more information on the Lassa fever virus. And if you have any more questions and concerns, feel free to contact me, okay?
Okay, thank you so much.
You're welcome.